Welcome to the Health Literacy Training Workshop. I am your presenter, Adam Brown. Health literacy is the ability to understand health information clearly and correctly. Health literacy affects the patient's ability to make educated healthcare decisions. Health literacy affects the patient's ability to make educated healthcare decisions. Health literacy includes accuracy of knowledge about the human body and its health. Individuals from all educational backgrounds may have poor health literacy. Improving health literacy is a responsibility of both the patient and medical staff. Ensuring the patient understands the information provided is a responsibility of the healthcare professional. Barriers to health literacy include language, culture, age, literacy, disability, and emotional state. Plain language is communication designed to meet the needs of the intended audience by putting together information in an understandable, appealing, useful, and relevant way. We are going to focus on two key areas of concern. The first is to engage in clear communication with patients. The second concern is to address differences in language and culture. About 30% of Brownville residents did not graduate from high school. The hospital has received many complaints about communication problems. Patients reported that the information provided was confusing and that they didn't know how to act upon it. We must empathize with patients. When considering clear communication in a healthcare setting, we must consider a few things. First off, communication can be especially difficult when a patient feels sick, scared, or is in pain. Medical terminology isn't easily understandable for many patients. Most people have not undergone extensive medical training and education. Language problems may cause embarrassment and withholding in the patient. Poor communication is bad for the patient and the hospital staff. Staff may miss pertinent information, misdiagnose and mistreat patients. Patients may not understand questions, information, or directions. Brownville is made up of many different ethnicities and cultures. 35% of Brownville residents are foreign-born and don't speak English at home. Language and cultural barriers between patient and medical professionals make communication difficult. Studies find that language barriers reduce treatment efficacy, adherence to prescribed treatment, and health outcomes. Patients may be embarrassed with communication difficulties and withhold relevant information or questions. If language issues are severe, a patient may go on autopilot and ignore their symptoms. Language barriers in the healthcare system create a disparity between English speakers and non-native speakers. Ignoring cultural differences may cause patients to feel disrespected or mocked. It is impossible to know every different culture, so observe their nonverbal communication and how they interact with their friends and family. Asking the patient directly about their culture in a respectful way is fine too. It can help establish trust and a relationship. Poor health literacy results in problems understanding health information from medical professionals, media sources, health labels, and prescriptions. People with low health literacy tend to have poor medication adherence, lack of knowledge about disease, poor adherence to self-care management, poor treatment outcomes, decreased likelihood of seeking medical care. Individuals with poor health literacy are less likely to seek screening programs, preventative services, and engage in health-promoting behaviors. Not understanding directions can cause insecurity in patients. This causes communications between the patient and staff. There are many national efforts to improve health literacy. The U.S. Department of Health and Human Services created the National Action Plan to improve health literacy. This program connects organizations, professionals, lawmakers, communities, and individuals to improve health literacy. This action plan is based on the belief that everyone has the right to information in order to make informed decisions and that health services should be performed in a way that is easy to understand. Healthy People 2020 is trying to reduce health disparities by improving health literacy and patient communication. The Affordable Care Act has key provisions that can apply to health literacy improvements. It includes the expansion of public insurance coverage, the simplification of the enrollment process, provisions assuring equity in healthcare and communication among all populations. Provisions also focus on altering medication labeling and the ability to train healthcare providers on literacy issues. The National Institute of Health, the NIH, sponsors the Clear Communication Program. This program is focused on cultural respect, plain language, and health literacy. Language Access Services is a national program aimed to help people with limited English communicate in healthcare and judicial settings. Services include oral assistance, translation of written materials, and translation of digital information and web content. Here is a list of how to communicate clearly. Simplify your message. Try using basic language. Be conscious of the intended audience. Try to figure out the level at which you can talk to them. Repeat the most essential information multiple times to make sure the patient remembers. Summarize the main points after more detailed descriptions. It is a conversation, not a speech. Both sides need to contribute. Frequently ask, does this make sense? And other questions to promote engagement. Ask patients questions to verify understanding. Observe accuracy and confidence in the explanation. And listen to find gaps in their knowledge. Your patient may be sick or scared. Be empathetic with them. Speak clearly and thoughtfully. If the patient has a problem understanding it, try to speak slower and enunciate and simplify your message. Be nice and engage with the patient. Make the patient feel comfortable using eye contact, appropriate body contact, positive body language, and a respectful tone. This makes the patients feel comfortable about asking questions. Ensure the patient doesn't have any conditions that could prevent them from understanding, like hearing loss, dementia, cognitive disabilities, language barriers, or illiteracy. And remember, you are responsible for any communication failure. Here are different parts of language that are problematic and that you should avoid. Jargon, abbreviations, acronyms, homonyms, heterographs, idioms, and proverbs. Now I will speak about addressing language and cultural barriers. The easiest tactic is to speak at a slow pace, but don't speak at an offensively slow speed. Be respectful to cultural differences. Try to greet patients in their own language if you know it. Your pronunciation may be wrong, but it is a nice gesture. They are going through the same embarrassment. You may need to ask who makes family decisions for the family. Some cultures require consent from someone else in the family. Use common words and avoid problematic language. Pay attention to nonverbal language. Encourage questions from patient and family. Try to have pre-translated forms, pamphlets, and medical information in different languages available. Try using alternative means of communication, like drawings, stories, metaphors, and hands-on practice. The most effective way to communicate with a non-English speaking patient is by using a professional interpreter. Interpreters are trained in language, medical vocabulary, neutrality, and confidentiality. Interpreters make patients feel more comfortable because of the shared language and knowledge of the patient's culture. Some hospitals have on-site interpreters, but it is impossible to have enough people to cover all languages. Over the phone and internet interpretation services are available as well. These are more cost-effective than on-site translators. Use caution if having a family member translate instead of a professional. You must be aware of the translator's health literacy. Be sure to talk to the patient, not to the translator. It prevents engagement with the patient and is considered to be very rude. Remember, this will take much longer than a regular conversation. Be patient with them and try not to value speed over quality. Here are techniques for improving patient understanding. The teach-back technique confirms patient understanding by having them explain information back to the professional. One can assess the level of understanding based on the explanation provided. Be aware of nonverbal language and confidence with material while they explain things to you. Try to reinforce learning by reiterating the most important points. Try to create simple drawings for patients. It may be the key to patient understanding. It can also be fun. Another alternative is using basic analogies. You can also provide easily understood educational material in their preferred language. If you begin to get frustrated, ask a coworker to observe the interaction and give you feedback. You might learn something. Everyone should have the right to make informed decisions for themselves. This is called autonomy. To provide informed consent, patients must understand their options. Patient decisions should be free from coercion from staff, friends, and family. The staff must include an appropriate amount of information when explaining things to patients. Too much information will overwhelm the patient and may confuse them. Too little information will lack some important information that is critical for making an informed decision. Providing too little information is a problem when talking to people that have poor communication skills or speak another language. Impatience and frustration with the patients can lead to inadequate explanations. No matter what, some patients with cognitive problems and other inadequacies may not be able to understand what you're telling them. It is unethical to allow incompetent patients to give informed consent. Patient autonomy can be frustrating, but it is their decision. Some patients will reject your medical advice, and you must remember that it is unethical to coerce them into something they might not want to do. So this is where we are breaking and stopping part 1 of the video exercises. We will pick up in the next video with the exercises to improve health literacy. Thanks.